here shortly. Governor, what we're going to do now is if you would like to say a couple remarks from the podium, and then we can turn it over to Mr. Kern, and then we will start with the vaccinations after that. I will say, if you don't mind, or if you wouldn't mind, say make sure we keep this social distance from it. It means a lot more coming from a good doctor.
All right, I will be glad to do that. Well, good afternoon, everybody. And thanks so much. This is really an historical and I think a very exciting day for the Commonwealth and really for this country. I think it's fair to say that we've all been in a dark, long tunnel for 10 months now. And to have this vaccination and for this to be the first day of administering that vaccination is really hope, and it's the light at the end of that tunnel. So I want to first of all thank Sentara for having us here today. As you know, I have spent some time next door and actually here, but mainly at King's Daughters Hospital. And I think we're truly blessed in Hampton Roads in Virginia to have such great healthcare systems. And to all of you that are a part of that, on behalf of Virginia, I say thank you. I have watched this pandemic evolve. We have come a long way. We've learned a lot, whether it be about PPE or testing or tracing or the development of this vaccination. But my heart really goes out to our frontline healthcare workers, those that have come in every day, 24 hours and working on weekends to take care of individuals across the Commonwealth that have been exposed and have contracted COVID-19. And being a physician myself and being part of the healthcare team, this is not easy work. And what you all have done, not only exposing yourselves, but exposing your families, it's just truly commendable. And so I can't thank you enough, and on behalf of the Commonwealth of Virginia, we appreciate it, and we hope that you stay healthy and safe, and also that you continue to do the great work that you've been doing. The last thing I want to say before I turn it over to Mr. Kern is that we have several months ahead of us where we have to remain vigilant. And I appreciate you here today for keeping your distancing, for wearing your mask, for washing our hands, sanitizing our hands frequently. We know that these things work. And until all Virginians, all Americans have access to this vaccination, which we hope will happen in the next few months, we all have to remain vigilant and do our job, have the responsibility, and really be part of the solution to get this pandemic behind us, because we can all agree that we want to get back to our near normal. We want our children to be back in school. We want business to be back up and running. But in order to do that, in order to have an economic recovery, we've got to deal with the health crisis. And again, for all that you have done to be part of that team, I say thank you. I had the opportunity to say hello and meet Yolanda. Yolanda, which direction? There you are. Thank you so much. I know Yolanda works in the emergency room, and I know you're proud. You've been here for, I think, close to 20 years, did you say? And wow, that's really commendable. And I think the message that you and that all of us send today, that this vaccination is safe and it's effective, and we encourage all Virginians to really get the vaccination, is an important message. So I thank you. So without further ado, I know you all have a lot of work to do. It's a busy time, but Howard, I welcome you to the podium, and thank you for having us here today. Thank you all.
Thank you, Governor. And we really appreciate your being here today, and especially appreciate your steady hand in leading Virginia through what has been probably the most challenging public health crisis of our generation and of our time. I think as you look at Virginia compared to many other states in the country, we have fared much better, and it's really been quite a challenge to balance the public health and needs of the citizens of the Commonwealth against the economic interests and try to keep it all in perspective. And I think Governor Northam has done a phenomenal job, and thank you very much for everything you've done. I can remember back in a Saturday in very early March, Governor Northam asked to come out and visit our incident command center that we had set up as we were just getting organized and dealing with this very new disease called COVID-19 and trying to anticipate how it was going to affect us. And we were just beginning to realize that we were facing a pandemic of fairly monumental proportions. That time seems years ago today as we sit here in early December. And we are really facing some exciting times. As Governor said, we're really light at the end of the tunnel. I think that light is off in a ways. As the Governor has pointed out, we have an important process to work through that's going to take some time, and it's important for the public to realize that we have to be vigilant and patient as we go through the vaccination process. We've now come full circle, and we're here finally to vaccinate our frontline clinical staff and employees that have really worked tirelessly caring for our patients and our communities. I really want to commend our staff, our physicians, nurses, clinical staff, and therapists who have really taken really personal risks with their own lives in caring for our patients, and also is taking on significant risk and stress in going home every day and potentially exposing their families to these risks. This is incredible stress for our staff and for the organization, and I don't think a lot of people realize the kind of stress and difficulties that our staff have been through over this period of time. It has really been challenging beyond anything that I can imagine that the clinical caregivers have had to deal with. The commitment of our staff has really been significant and outstanding, and I am really proud of them and proud of all of our staff for this. Particularly want to recognize our Sentara Norfolk General leadership, some of whom are here today. Jessica Melton. Jessica is the interim president for Sentara Norfolk General Hospital. Tim Jennings is a vice president and chief pharmacy officer for Sentara. Have both been elements of critically leading this process for ensuring that we have this initial vaccination process well organized and safe. Our commitments to our patients are very important to us, as well as our commitment to our community. I want to remind our communities today that we are vaccinating our frontline clinical staffs and workers because they are critical to taking care of COVID patients. We are following state guidelines and CDC guidelines and prioritizing and phasing the approach for how all of our communities will ultimately be given an opportunity for immunization and vaccination against COVID. We are really focused on vaccination as a key to the ultimate challenge of managing this pandemic, and we'll be implementing vaccine clinics at all of our hospitals, first to take care of our staffs, and then to address the needs of our community. We are recognizing that this is a very complex process. We are thoughtful and careful in the way we've organized this process, as handling and storage of the vaccine is very complex and very exacting in its requirements. After we take care of these essential frontline clinical and support staff, others in the community will begin to receive the opportunity for vaccination, and that will be an important part of the process. It's essential that we are able to communicate and establish a process, and that we have people not coming here looking for a vaccination as they think it's just a matter of getting in line. It's important that we communicate and establish that protocol up front. Thank you again for being here today and sharing in this historic event and combating this terrible pandemic. So let me turn it over, I guess, to our vaccination team who's going to take over. And I don't know, Andy, who's going to take over from here?
Now we'll just go through our process of having vaccinations. So look for pharmacy, and then Yolanda, if you'll make your way down, we'll get it started. Thank you.
That's all right.
Pardon me, sir. So where is Yolanda? Where's Yolanda? We are, yeah, we got the fridge here to keep that nice chili. Where's Yolanda? Oh, there she is. Okay, we're ready to go. My name's Tim Jennings. I'm the Chief Pharmacy Officer for Sentara. And what I'd like to kind of show you is what we started off with. This project started, or I should say, 3 hours ago, we had to take some vaccine out of the ultra-cold freezer. We put it in the refrigerator because it takes that long to thaw. We then brought it down under temperature-controlled transportation, so we had it in an ice chest with water bottles that are frozen according to the way the CDC suggests that we transfer the vaccine. We brought it down here, put it in the refrigerator as an extra level of safety to make sure the vaccine, if just for some reason it wasn't used right away, it has a longer shelf life when it's in the fridge. So we're treating it like gold, making sure that the product doesn't go out of date. Our pharmacist, Charles Rawls, did a very nice job and reconstituted the vial, because the vial has to be reconstituted with some sodium chloride. And because it's a very gentle mixing process, because it's a protein, if you shake it, it froths and it won't be usable. So it's very, very methodical, and it has to be done over about a minute time frame. So he did all of that, prepared the vaccine, drew it up in the syringes, and then we've shared the syringes with our colleagues over here after they've been fully labeled. And we're doing this, Charles is a pharmacist, and the reason we're doing it with that level of mixing is because of the complex nature of taking it out and making sure we understand all those time frames. Because if the vaccine sits out on the counter undiluted for more than 2 hours, it's no longer viable. So, Yolanda, why don't you come over? Our very first person, come on. Right over here. So what Yolanda's going to be doing is sitting down, getting some education about the drug through the emergency use authorization fact sheet that's produced by the FDA. She had some time to read that beforehand and answer any questions. And this is Jim, our nurse, who's going to be administering the vaccination. It's given IM in the deltoid, intramuscular. But under the careful guise of a very accomplished vaccinated nurse, you barely feel it.
Linda says she doesn't like needles. This is a small one.
He's just showing her that it's the vaccine, validating the medication on the vial and the syringe. We are now one Virginian closer to overcoming the pandemic. Nice job. Now, Yolanda has to be monitored for 15 minutes after she's given the vaccine. So we have some chairs set up over here where she can go and sit. Before she does that, they're going to talk to her about her next appointment, because it has to be 21 days from today. And they'll coordinate the time and get commitment that the person will be coming back. And then Yolanda can be able to sit down and be observed for those 15 minutes. So we might as well keep on coming. So, yep, come on up. Is that okay? Come on over when you're ready. When you're ready. All the way to the far side. Did I do okay? Today we are vaccinating one environmental services associate. That was Yolanda. She was our very first. We will also do a respiratory therapist. And we have 3 physicians that are coming forward today. And we have the balance between nurses and nursing techs. So we're getting all frontline employees to get vaccinated, because all of our staff take care of patients, and that's why we're trying to make sure we have people getting it who need it the best. Dr. Britt? Good job, Jim. Come on, next. Sorry.
No, it's just, yeah.